Okay, today we're going to talk about our avian exams. So, there are so many species of birds that we may or may not see in the clinic. If you work in a mixed practice where you're seeing exotics, you may see the pets of the small parrots, large parrots, chickens, and then some of these local places help volunteer with wildlife rehab, so you may see eagles, owls, hawks, things like that. What is coming in is going to depend on what supplies you need, so it's important to gather those before whatever's coming in, because with birds you have a kind of short time frame that you're going to be working with these animals. They do get stressed out pretty easily, so you want to have everything ready to go, and things that you may not need would still be good to have on hand, like your blood supplies, having your oxygen cage set up in case that animal gets stressed out and we need to put them in to the oxygen cage to calm down. Having things like protective things such as gloves, towels, a little light. Sometimes when we are capturing these big birds, they'll bring a huge cage, and sometimes you can actually turn off the lights and use a small pen light and capture that bird. It tends to work out a little easier. So have all those things ready to go before that animal even gets to your clinic. The other thing you want to have ready is a plan of where the animal is going to go. If you are a clinic that sees dogs, cats, anything else, you're going to have a lobby full of kids, family, pets, all the things. That may not be where you want that bird hanging out while it's waiting to get into that appointment. Sometimes we'll tell our clients to wait in the car and give us a call when they get here. Sometimes we are watching for them and we can pull them in a room as soon as they get in there. But having these animals that are already going to be stressed, and stress can cause death in birds especially, we want to do our part in making sure things go as smoothly as possible. If you can get them in a room right away, great, that's what I would do. Once you get that animal in there, making sure everything's set up escape proof is really important too. Remember, birds can fly, most of them. So going into a room with super high ceilings may not be your best choice when you're seeing birds. Because if they get away, the first place they're going to go is up. They almost always try to find the highest place, and that tends to be where we can't reach. So be aware of that when you're choosing where you're going to do your bird exam. Sometimes people will bring them in big, large cages and you have to try to catch them. Sometimes they'll bring them in little carriers, like a cat carrier. And those are nice because you can kind of reach in and grab them. A lot of times when you do reach in, however, they will bite or scratch. If you have raptors, they're typically going to turn on their back and grab you with their feet, which they are extremely powerful. So you need to make sure you're protecting yourself, as well as making sure while you're grabbing that animal, you are not squeezing them and you are not going to injure them by mistake. Our biggest thing when restraining birds is making sure we're not squeezing them, because they do have air sacs and you can actually suffocate them. When it comes to your exam, the first thing you're going to do is when they come in, you're going to start looking at them. You're not putting your hands on them at this point. You're looking at how they're acting in the cage. Are they standing? Are they walking around? Are they hunched in the corner? Do you see any droppings and what color those may be? Sometimes when people bring their whole entire cage in, sometimes it can be bulky and crazy, but it also can be a really good example of everything that they have going on at home. You can see the type of food they're feeding, the type of toys they're playing with, the type of substrate or cleaning, and all those supplies are right there in front of you. If they're not, we're going to start asking questions about that. The other thing I like to do, especially with exotics, is when they're making an appointment, I ask them to take a picture of their home cage and their setup, their food, their cleaning supplies, so then we can see it for sure. When people get into their appointment, sometimes they're nervous, sometimes they forget, or they don't remember a product or things like that. So this just helps us know exactly what's being used on that animal. After I've done kind of a once over with visual, then I will go in and get a hold of the animal. Again, you can use a towel. Some of the smaller birds, you don't necessarily need a towel, but it is helpful. You can do what's called 2-finger hold. I'm not squeezing. I'm not going to squeeze around the neck, but I have kind of a hold, and I have the wings tucked in. Then I'm going to do a full once over like we would on our cats and dogs. We're going to be checking beak, nose, eyes. Our keel is going to be kind of right in here. We will feel and see if that feels muscular or really bony. Checking nails and toes, making sure those are all set. The other thing we'll take a look at is those wings. We can extend those out. Sometimes we will do wing trims here so that way they are not flying. Sometimes they will bite you, so you do need to be careful. Checking that other wing, we definitely want symmetry when we are looking at birds. Some of these birds will drop feathers, so we do have to be aware of that. And then once you do a good once over, letting them back to take a breath. If we need to do any kind of blood work or things like that, we would do that at that time. When it comes to talking to your owners, it's going to be important to know where their cage is located in the house. Do they have direct sunlight? Is it drafty? Do they have access to the kitchen? There's a lot of things in the kitchen that can be very dangerous to pet birds. Making sure what kind of toys they're using. We don't want anything with any lead paint. Unfortunately, there is a lot of things online and at cheap stores that sometimes you can find that aren't always safe for our birds. You probably have heard it with your cats and dogs. It is the same for exotics. So you just want to make sure you're using quality products. In terms of food, making sure we're feeding the right products. A lot of our birds should not be on seed 24/7, making sure we have pellets and we're using good products. I'm a big fan of Oxbow in Missouri for my exotic food just because I know it's been tested, it's a good product. But do your research on who you want to support and who you think would be a good product for your clients. As long as you do your research, I think any brand that you feel comfortable backing is great. Knowing how long that they've had this animal. Sometimes they've had it since it was hatched. Sometimes they have not had it at all until maybe an owner passed away. Birds live a long time, so sometimes they are switched from owner to owner. We do see a lot of behavioral issues in birds, so if we're talking about behavior, knowing who's in the house, what's going on in the house, is there anything that triggers that certain behavior in the house, can be really important. You're going to be asking questions. It's going to feel like you are just interrogating that client, and it's not meant to be. But this is our biggest way. So many of our exotics have health issues just due to something in their husbandry or even diet. The other thing is, do they live alone? Some of these birds are really social and they can be affected by living alone. They can have certain behaviors, express those behaviors to people or themselves because they are alone. So finding out who they're housed with, maybe they were housed with somebody and that other bird just died. That all can play an effect in how this bird is acting. Making sure we're looking at feces, that can tell us quite a bit. You'll learn in your chapters that the color of the feces can mean a lot of different things. And then the other thing is making sure we know what type of bird we have in terms of diet can be really important. What this little parakeet is going to eat is going to be completely different than some of our wild birds, even some of our songbirds. Even though they are out in the wild, somebody finds a cardinal, they should not be feeding them millet and pet bird food. Those animals should be brought in, and typically we are requesting they do not feed those wild animals and they are transferred to a wildlife rehabber. But many times we are that person in between. The other thing is when you see someone bring in a raptor or an owl, eagles, things like that, you definitely don't want them feeding them because they have a very specific diet, and even though it's meat, it's not any kind of meat. So if you feed hamburger, processed chicken, they can actually cause more issues. Again, people don't know who to call, so they call us at the vet office, and we can be that middleman where they can bring them in, we can examine them, and get them to a licensed rehabber. When you are done with your exam and your doctor's done, you then can go over any medications. It can be important to show owners how to do medications because it can be a little tricky, especially when we have beaks. So show them how to do that, show them how to hold. We don't want them squeezing the animal when they're trying to give them medication and accidentally kill their bird. Going over, typically it's going to be a pretty small amount of medication if they are doing any meds. So we're making sure that we're discussing that and how to properly give that and how much. When they go to check out, again, we don't want them just going out in the lobby and getting super stressed out. We've now stressed that bird to the point of bringing them into the clinic, getting a exam, getting whatever else they need done, whether it's blood work, x-rays, maybe it's just a nail trim. But that bird is at its maximum stress now. We don't want to just send them out in the lobby with a barking Great Dane. So sometimes we can hold on to the bird in the back while the client checks out and bring them as they're ready to walk out the door. Or sometimes reception can even come into the room and check them out in the room, just so we're not stressing that animal out. So that is your avian exam in a nutshell. There is going to be so much more that you're going to learn hands-on at your first lab. We'll talk a little bit more about those exams, but hopefully when you get into your clinic and you're doing an exam, you feel prepared.